Hi, my name is Petronella. Welcome to my channel. Thank you very much for joining me one more time to complete this session on SOAP notes. So in the last video, I was discussing SOAP, which means simply subjective, objective, assessment, and plan. This is a document that as a student of advanced nursing practice, you will come across. Also, as a nurse practitioner, you will write these. So it is something you cannot ignore. I know often it is difficult to start it off, but eventually it gets easier. Every time you do it, it gets easier. So last time we looked at the subjective part of a SOAP. What does it entail? Just in summary, we said a SOAP needs to have the name or initials of the patient for the students, date of birth or age, the gender. Then from there you talk about the chief complaint, what has brought the patient in today. Is it cough times 5 days or 1 month? Then you have the HPI or the history of present illness, which you do through asking questions, history taking, and often there are many mnemonics, but we use old cards, the one we always talked about as nurses, old cards, where you talk about the onset, location, duration of illness, characteristics, alleviating or aggravating factors, where does the pain radiate to for the R, T for the treatment, and S for severity. Then you also include the past medical history of the patient, talk about the family history that is significant to the situation or the problem. You have the social history, we have the surgical history, talk about religion of the patient, immunization, allergies that the patient have or the patient has, and all this contribute to what the subjective part of the SOAP note is. So today we move on to the objective part of the SOAP note, and the one thing you need to know is that your objective part should match the subjective part. What do I mean? If your problem was cough and you have addressed in your subjective history taking, you have addressed the cardiovascular, the respiratory system, the abdomen or abdominal assessment, then you make sure those are the exact body systems that you address in the objective part also. So you talk about those and make sure they match what you have in the subjective part. Then again, just to address the general question or the constitutional part that always gives people a problem, talk about what do you observe on the patient? Is the patient pleasant? The general outlook. Are they energetic? Are they looking weak or lethargic? How appropriate is the developmental, the development aspect compared to the developmental stage. How about their habitats? Are they walking, crouched over or standing upright? How about their dressing? Are they dressed appropriately for the weather? Are they able to communicate? How good is their attention? Are they able to hold their attention for as long as you're talking to them, or they keep on wandering off in their thoughts? So make sure you address 3 body systems, the system affected, and 2 others, one above, one below, and any other system that may be affected by this illness or that may contribute to the differential diagnosis that you have. The other thing you include in the objectives is the vitals. So we are talking about the temperature, the respiratory rate, heart rate or pulse rate, blood pressure, pain is the 5th vital. But here we also include the height, the weight, the BMI of the patient, and don't forget the SpO2 or the oxygen concentration, saturation. Then under objective, you also talk about the tests. We have the tests that can be done in the office. So for example, you can do a urine dipstick if you suspect UTI or pregnancy. You can do a pregnancy test, you can do a fasting blood glucose, you can do an EKG, you can do, for some offices, they have the pulmonary function tests in case you're suspecting COPD or asthma. You can do a rapid strep, you have a sore throat, you can talk about rapid influenza to differentiate it from a sore throat. You can do a COVID-19 test also. So we have a few tests that can be done in the office. However, you cannot do things like the X-ray, you cannot do CT scans or ultrasounds in there. Those are things you include in the diagnostics. And this comes in the last part of the SOAP. Next part is assessment. Assessment includes your diagnosis. What's your diagnosis for the patient? This is the diagnosis you can reach without necessarily relying on tests that have to be done outside. For example, you can diagnose a UTI by doing urine dipstick. You can diagnose COVID by doing a COVID test, or strep throat by doing a strep test, if it's not a complicated situation. Do not declare a person to have pneumonia when you are not really able to do an X-ray. Just say they have a cough, but describe all the symptoms that they have. Anything that requires external diagnostics or diagnostics you don't have in the office, you cannot diagnose. You cannot diagnose a patient with cholecystitis. Why? Because you have not been able to do any sort of diagnostics on the patient. You can only talk about right upper quadrant pain, but not, and because you are suspicious of cholecystitis, then you suggest the diagnostics for your referral. Then from there, you have a diagnosis, and a patient can have more than one diagnosis. They can have otitis media and otitis externa at the same time. Somebody can have otitis media, or they can have a cough and at the same time something like maybe a high blood pressure, elevated blood pressure. So you can have more than one diagnosis. Then in the assessment, you also include the differential diagnosis. What does this mean? If somebody comes in with a cough, the first thing that should run in your mind is, what can cause a cough? Is it COPD? Is it allergies to ACE inhibitors? Is it asthma? Is it upper respiratory tract infection? Is it pneumonia? Is it TB? Is it GERD? Or is it pertussis, or rather whooping cough? So there's so many things that can cause, even GERD, it can cause coughing, but you have to come up with differential diagnosis based on the symptoms that you observe in your assessment or the signs. So from there you have, and after assessment you go to plan. So what plan do you have for this patient? I suspect the patient has pneumonia. I need to do diagnosis to confirm my diagnosis, so I'll send them out for an X-ray. I suspect my patient has maybe an inflamed liver. I send them for an ultrasound. So things that you cannot do. What diagnostics do you recommend for this patient? Are you sending them to radiology to go and do this? Are you sending them to a pulmonologist to go and do tests on pulmonary function tests? So decide. Then from there you talk about, okay, I've come up with my diagnosis. If I have my diagnosis, how am I going to treat it? So treatment. It can be either pharmacological or non-pharmacological. For example, if it's a cold, regular cold, you can just treat the symptoms non-pharmacologically using fluids, which ensure the patient is hydrated, giving them fruits that give them vitamin C. But it can also be pharmacological. For example, you can give them decongestants, you can give them mucolytics, for coughs and such. So what medicine are you going to give? Are you going to give azithromycin, or are you going to give amoxicillin, 500 milligrams BID? Know how many times in a day and how many days for the therapy. Then from there you give education to the patients. This is under plan. Education, what are you going to educate them on? Stay hydrated if you have a cold. If it's asthma, keep off your allergens or your triggers that cause your COPD exacerbation or asthma exacerbation. Then from there, you do follow-up. When do you want to see the patient again? Is it after the test results are available? Is it in 2 weeks? Is it in 3 months or 2 months? Do you have any referrals? This is a section where you include the referrals. So do you want them to go to see the urologist because they have recurrent UTIs? Do you want them to see a cardiologist because they have chest pain? Do you want them to see a pulmonologist because they have this new onset COPD, so that they can decide what treatment to put them on? So what referrals do you have? So under plan, what you're going to have is diagnostics, the treatment for your diagnosis, then education for your patients, follow-up, and or referrals. Then finally, we have the prescription notes. What information should be given to the patients regarding your prescription? How is the medication supposed to be taken? Take 1 tablet in the morning of omeprazole before breakfast, 1 hour before breakfast. And then take 1 tablet per day, 20 milligrams per day for 2 weeks. So if it's 1 tablet, you need 2 weeks is 14 days, so you need 14 tablets. Do you need refills or not? So under this part, you say give instructions how the medication is going to be taken, how many days, how many tablets should be dispensed, do you have refills or not, and if there are refills, how many refills are going to be there. So that brings us to the end of the SOAP. We have talked about the subjective, where the patient tells you everything they know about the disease. Objective, where you assess the patient. Assessment, where you put down your diagnosis and your differential diagnosis, what can be confused for the main diagnosis. Then you have also the plan, and under the plan you have diagnostics, treatment, education, follow-up, referrals, and the prescription notes come to at the end of everything. Thank you so much for being with me again. I hope this session has been quite informative for you. I hope it helps somebody somewhere learn how to do SOAP notes, and I hope it makes your studying as a nurse easier, a nurse practitioner, easier, and also as a nurse practitioner in your practice. If you like this video, if it was informative for you, if it helped you in any way, please don't forget to like and press the subscribe button so that you can get more of my videos as they come by. Thank you for watching. Bye-bye.